counts above 100,000. And if it's not, you can always talk to your hematologist and get a platelet transfusion before your surgery. All right, Sean?
What's above 100 is not so much the number, it's how functional.
Yeah, very good point. Hold on, are we twisted?
Yes.
All right, Sean? We're doing bilateral piriformis, everyone agrees? All right there, go ahead. All right, folks, we're going to treat the piriformis muscle. Anthony, let's show the audience how the piriformis muscle gets damaged and how we fix it.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. Luis, I need a hemostat. Not a lap, what is that called? Coker. Always have a hemostat on the tray. All right. So you can see from the video that what we're doing here is taking a damaged muscle that is prone to causing pain, and we are cutting the scar tissue inside the muscle that is causing the pain in the buttock and down the leg. That's what this patient has on both sides, left and right. Sean? All right, any questions?
Yes. We have a question from
Sean?
Kimberly on Facebook.
Kimberly.
Sean?
Of course. Kimberly, nice to meet you. We'll take your question.
Other physicians do endoscopic procedures, but you also do laser. What is the purpose of the use of the laser? What is the chance of relapsing / re-injuring due to repetitive motions due to work?
Well, Kim, that's a great question. So first of all, yeah, we are the ones who use laser. The laser is the most precise tool in medicine. And what we're doing is we're doing a debridement of the annular tear, which cannot be done without laser. So these other surgeons that you're talking about, they're not doing what we're doing. You pointed that out because they're not using the laser. Therefore, they're not doing what we're doing. But the laser is absolutely essential to achieving the surgical goal of eliminating back pain. Sean? If you don't use the laser, you are not going to get rid of people's back pain. And the people that I treat, they all want us to get rid of their back pain. So if you don't care about back pain, then you probably could do one of those endoscopic surgeries that don't use the laser. But if you care about back pain, then you should do the Deuk laser disc repair, the procedure that we do. We're done. Thank you. I'll take one more question if there is one.
Yes. We have a question from Keith on Facebook.
Yes, Keith.
Can pain going down both legs from butt cheeks be from back issues or from the piriformis or both?
Keith, you are awesome. So I'm going to show you, Keith, since you asked. Here is the back, here is the buttocks, here are the legs. So when you have your spinal cord ends here, it gives off nerve called nerve roots. There's 5 of them that come together and make up the lumbosacral plexus. All right? Actually 4 make up the lumbosacral plexus. Actually 5, but then 4 of them make up the sciatic. So you can pinch the nerves here with herniated discs. That's the most common reason people get sciatica. Number 1, sciatica. She's going to love me for writing this on her, but it's all going to come off. All right, so number 1 reason people get sciatic pain down their leg is this, pinch nerve in the back from a herniated disc. That's what the laser surgery does. That's what we just did. Now, the second most common reason people get sciatica is the sciatic nerve is a bundle of these 4 nerves that come down and runs down your leg, right? Well, the piriformis muscle comes off your tailbone called the sacrum, and the piriformis gets a tear in the center, and it gets all this inflammation and scar tissue developing. But guess what? The sciatic nerve is running right through it or just under it. So it gets pinched here and it causes sciatica. This is the number 2 reason people get sciatica. Pinched sciatic nerve or irritated sciatic nerve at the level of the piriformis muscle. That's what we just fixed, okay? Then there's other causes that are very minor. They're not common, they're rare, like pelvic tumors, and you can also get calf stuff in the leg from a knee problem or a Baker's cyst or vein issues. Thanks for joining us. Great questions. We'll be back we'll be back today. We have one more patient who travels here from, where is he from? St. Augustine. All right, he's from, the last patient's from St. Augustine. He's got bilateral piriformis. So just like this patient, we're going to go in and do 2 piriformis releases. Thanks for joining us. And good morning, I'm Dr. Deukmedjian. I'm here with one of my lovely patients who, she had some words of wisdom for me this morning. Keep smiling. And you're smiling a lot today.
I am out of pain.
Out of pain, good. So she had a piriformis muscle release done. How do you feel?
Good for morning after.
Yeah,
Good.
feel good.
Ready
And
to go.
can you tell if that piriformis pain is gone or is it still there?
It's gone. It's just from the pressure from the surgery, but I'm good to go.
Yeah, everybody has a little discomfort from the
Yeah,
surgery,
I
but
understand that,
you can
yeah.
tell the piriformis pain is gone.
Yes.
Congratulations. We
Yeah.
did it with minimally invasive, 4 millimeter little cut on the back of your hip there. And we just go in with our probe and we cut up the scar tissue that's, causing all the pain, release the muscle, and that causes the pain to go away right away. So what was life like for you before, when you still had this horrible pain?
Very restrictive. I wasn't walking. PT, wasn't even helping. And the injections, that was ongoing with Dr. Patel for a while. But I hope to get back to life.
That's it.
No pain. That's the biggest thing. That takes too much out of you. It's not a way to live.
A life in pain is
Yeah.
not good. Or
And I was
afraid of,
miserable. I was making everybody miserable.
or fear of pain, by doing
Yeah.
something to set it off.
Yeah.
Now the pain you had in your buttock, this piriformis pain,
Uh-huh.
was it constant or did it kind of get worse with certain activity?
It got worse during the day. The
Yeah.
more you did, and you just have to back off. I did ice and heat. And Dr. Patel did the injections, and it's just not immediate relief, but, I got some. But no, yesterday was a good thing.
Now you're a dog lover, right? And you have a new puppy, you told me.
Yes, I have a little mini schnauzer, Darby. So
Darby.
now I can go with her. I can run and pick her up.
And that's it. Picking up is key because when you bend over to pick something up from the ground like a little dog, it usually aggravates the pain from the piriformis in the buttock. All right, so anything else you want to share with your viewers and fans out there?
Don't let it go. Get help, come to the clinic, and enjoy life now. I really will.
Congratulations, you took
Thank
the leap
you.
of faith and you got it done. Go enjoy life.
Have a glass of wine on me.
Right. Sounds good. Let's get you out of here.